My name is Michael Shaneyfeld. I'm from Birmingham, Alabama. The question that I brought to the board is that in 2000 I was approached by an ex-Navy sub diver, and he brought to my attention the use of an auditory weapon that he stole from the United States Navy. Yeah, he told me about this weapon that he stole from the Navy. And he told me how the weapon would affect the central nervous system of a human. And he wanted me to go out and assist him in certain things. And in 2006, my life changed. I woke up one night and I got a strong electrical shock in the center of my chest. From that, I started to have problems with my heart. I started having bigeminis, irregular rhythms. Went in and to the hospital. The doctors determined that I was getting electrical shock through my chest. Then I went in and had an operation done, ablation. And all this just keeps going on. From then it went to my lungs. Then from there it went to my kidneys. From there it went to my bladder. From there it went to my colon. And it keeps going on and on and on. Medically, I've been looked at and reviewed over and over and over again. My brother, he's a doctor. My sister, she's a nurse. My nephew's a nurse. And I've got people that have talked to me about medical situations and medical views. And I know exactly what's occurring is wrong, and I feel like I'm a test subject. And I've responded to the government, and the government responded back to me. But I have not seen no action. I've given y'all a report, and y'all can look at the letters that I've sent in.
Gerald Schatz. Thank you. My name is Gerald Schatz, and I'm a lawyer and retired assistant professor of ethics and law at Michigan State University. I want to address two things very quickly. One is the theme of vulnerability and its recognition. We have gone from an era of very reflective and I think very decent recognition of the moral obligations of researchers to an era of discussion of regulatory burden. I think that's unseemly. The second point is that there is law out there. The bioethics community has been oblivious to it, but there is international law. There is the International Covenant on Civil and Political Rights, the United States ratified in 1992, and it makes informed consent an absolute requirement, no exceptions, not even in emergencies, subject to those normal legal fictions of consenting for the incapacitated patient to medical care and so forth. Additionally, the Geneva Conventions and additional protocols to the Geneva Conventions make research very, very difficult or prohibited altogether for those individuals who are caught up in war and armed conflicts. Michigan State University faculty responded to the OHARP request for comment in 2005 on equivalent protections. I will be pleased to provide that comment and those citations and some additional materials to the Commission. Thank you.
Thank you.
Sina Ryan.
Thank you very much. My name is Sina Ryan. I am an Iranian American, been living here since 1976. To answer the question to the chair lady that if it's still going to happen or it's still going on, I will assure you that it's still experimentation going on, and one of live standing right here. I strongly believe that I have been targeted for the experimentation of a brain research since September 2008. Without my consent, they are controlling my mind and using electronic remote control. device to send instruction. In the past 2.5 years, I have been subjected to constant electric shock, sleep disturbance, sleep deprivation, short but severe localized pain into various parts of my body, telephone and bell rings in my ears, heat waves through my body, horrifying dreams, creating sudden fear and worries in my mind. They do these mostly when I am inside my apartment, but sometimes some of this happens when I'm outside without I'm seeing anybody or any device. These experimentations are done to me without any touch or anything, see anybody. This inhuman and painful method of torture include reading my thoughts and memories. Through this, they have been able to control me and subject me to severe pain that I have been suffering for the past 29 months. My health has deteriorated during this time, and I have no medical insurance to seek medical help. My life is in danger, and I need your help from the government. I am only asking them to stop this painful torture and leave me alone so I can go back to my life. Thank you.
Thank you.
Dr. John Hall.
My name is Dr. John Hall. I'm a medical doctor from Texas. As I understand experimentation, in reviewing the common rule, it's very obvious that there's a lot of loopholes to informed consent. All of the horrific experiments you've mentioned, Willowbrook, MK Ultra, radiation experiments, mostly were done without informed consent. They were funded by the DoD and intelligence agencies, where I'm not even so sure you would know if there's an IRB, much less if an IRB is looking at informed consent. As a physician, relative to some of what you're hearing today, in the community, we are seeing an alarming rate of complaints of use of electromagnetic weapons, microwave auditory effects, silent sound spectrum, EEG cloning, which has taken the lab out of the laboratory and into the home. Most of these, from the research that we reviewed, can be done remotely. It seems to be more weapons research than medical research. I personally corresponded with upwards of 1,500 victims, all complaining of identical complaints from every state in the nation of being exposed to electromagnetic radiation, non-ionizing radiation for the use of cognitive control or behavior control. I've submitted a paper to you, and there's another paper submitted to each member from another physician in Kansas City, alluding to the same thing.
Thank you.
Mrs. Hall. Okay. Mr. No, it's okay. Mr. Millicent Black. Oh, madam.
My name is Millicent Black. I'm from Tennessee, possibly a transgenerational person whose family members have been used for at least 3 generations, and I'm the second one. My dad possibly was the first one who was admitted to a Nashville hospital with a pineal gland tumor, left there with a plate in the back of his head, not the front of his head where his pineal gland would have been. At his death, before his death, I sought legal counsel for some horrendous treatment he had received at a nursing home that was also partnering with that hospital in Nashville, only to find out that a judge told the attorneys to drop that case. I am a part of the group that's here today representing those who are receiving the electromagnetic torture, and even my daughter at 5 months old was referred to that same Nashville hospital after having been refused